All right, well, you know, here at Sonoran Living Live and on ABC 15, we have been dedicated and committed to your heart health. As a matter of fact, if you haven't signed up for our monthly reminders, I'm going to tell you how to do that in just a minute. But first, arterial fibrillation, or AFib. As many of you know it as a serious condition that can lead to stroke, even death. And you know what? Most of us don't even know that we have it. Although it is serious, it is treatable. And I want to introduce you to cardiologist Dr. Scott and Dr. Shree, who I'm so excited and grateful for the both of you joining us here this morning, because AFib is something that I had no idea. People talk about AFib being, oh, yeah, I've got AFib. This is serious stuff, right, Dr. Shree?
This can lead to serious issues such as stroke. Many people don't even know that they have it. Sometimes they can have palpitations or skipped heartbeats or irregular beats. Many of them may complain of lightheadedness, but several patients end up finding out incidentally, and then we have to consider giving them treatment that is necessary to make them feel healthy.
Well, and that is why you're here this morning, is to talk about the treatment, because at Mayo Clinic, I know that you're all, you know, technologically driven and working hard on that. Dr. Scott, let's take a look at a normal heart. I mean, we've all seen what a normal heart looks like, but explain, I want to see how it looks now in normal conditions as compared to an AFib.
Okay, thank you, Terry. This is the, on that movie, you see the normal heartbeat being generated in the upper chamber of the hearts, which is the one that you have the purple arrows. And that heartbeat will travel down to the lower chambers. I don't know if the movie is playing there, but
Yeah, okay.
will travel down to the lower chambers towards that black area there.
Okay.
Little specialized electrical system that will go to the lower chambers to pump the blood.
Okay.
So the normal heartbeat will be rhythmic, will be in sync from the upper and lower chambers.
Okay.
So that would be the normal one.
Okay, so, and I think we all know what a normal heartbeat feels like, right? Let's take a look at what could potentially be an irregular heartbeat, or AFib. Explain this, Dr. Scott.
Yeah, so in that other sketch there, that movie, you see those electrical signals coming from the upper chamber of the hearts there in yellow, and you see those irregular and rapid firing. So that's what atrial fibrillation is, where your upper chamber quivers and goes very fast. And as they go fast, they make the lower chamber go fast too, and that can lead to symptoms.
Okay, let's talk about those symptoms, Dr. Shree. When we think about, when we feel certain issues happening in our body, there are a few identifiable symptoms, and if we could go over those for us real quickly. We're first of all focusing on tired and lack of energy.
Yes, because the upper chambers are necessary for pumping enough amount of blood. When the upper chamber is chaotic and rapid, the bottom chambers in return don't pump effectively, so the amount of blood pumped is less, so you feel tired, and not enough blood going to the brain would make you feel lightheaded, dizzy. Very rarely one can even faint if the heart were to beat very rapidly.
Really?
Yes, indeed.
And as I look at some of those symptoms, though, I'm thinking that a lot of people might mistake that for an actual heart attack.
Indeed, a lot of people urgently present to the emergency room for heart attacks and end up having atrial fibrillation.
Wow.
And then we are asked to treat the atrial fibrillation. We are subsequently called by the cardiologist.
Okay, let's talk about some of those treatments, and let's take a look at a procedure that you do, and tell me, Dr. Scott, what we're seeing.
Yeah, so in that movie, we see one of the treatments that we employ to a selected group of patients with atrial fibrillation who are usually refractory to the common medication we give for that. We can put a catheter through the in the body, in the heart, and we can eliminate the electrical signals that maybe arise from the some certain areas of the heart.
Is this a less invasive procedure than in the past?
No, well, it is still invasive.
Okay.
It's percutaneous, it's like almost like an angiogram, but that's for selected patients. I think the main message for patients is that if they have symptoms, they have to look for help or try to make a diagnosis, and I cannot stress how important it is to prevent stroke in this condition. Because when the upper chambers are quivering, not pumping blood in the normal way, one of the main consequences of that, and most serious, definitely is the risk of stroke. 15 to 20% of the strokes are related to atrial fibrillation. If people don't know they have it or don't prevent it with blood thinners, they can suffer a major problem.
Well, and I know that both of you are here today because the message is that it is treatable, and our ongoing message is that it's preventable if you continue to take care of your body and your heart. And thank you to both of you for being here and talking about how important to pay attention to these symptoms, address them as soon as you're concerned. It better be safe than sorry. You know, ABC is teaming up with the Mayo Clinic for our Rally for Red campaign. Now, each month we're going to give you tips and tricks to help keep you and your loved one's heart healthy. To learn more and get our Rally for Red reminders, you can sign up at abc15.com/rallyforred. Thank you to both of you.